So, dear viewers, welcome back again to Arimjoke Dental Clinics. This is another session, a second session of our oral health discussion. And my able discussants here, as you can see, these are new sets of dental therapy students from Ogun State College of Health Technology. They are posted here for their serious experience. So we want to tap from their wealth of knowledge so that all we can have an oral disease-free population. So the main agenda of this particular sensitization is we want to reduce oral disease burden in the society, in Nigeria and all over the world. Health education remains a qualitative tool for improving oral health and hygiene. So with me in the studio is Fatia. Okay. You are welcome to Arimjoke Dental Clinics. Once again, are you? You're also a dental therapist. Yeah. Wow, that's good. Well, I remain my honorable self, Idowu Michael Oladmiji. So let's start from you. What do you have in store for us today?
The causes and management of halitosis in children, adults, and the elder people.
Wow, so you mean children too, they have halitosis?
Yes, they do have halitosis.
But like what age?
And, around age 2 or 1. Even children that are breastfeeding, that are still breastfeeding, they have halitosis.
Okay, but what are the exact causes of this halitosis?
There are many causes of halitosis, but the main causes and the common cause is poor oral hygiene. So parents don't take care of their children's teeth. They feel like they are still young and they feel like their mouth can't be smelling. So the main cause is poor oral hygiene because they didn't take care of their children's mouths. They feel like they don't need to brush their teeth. So and also another cause is eating of sugary foods. Sugary stuff like snacks, because a lot of parents now see it as a normal thing to give their children snacks every time. Even in between meals, they give them snacks. So when after you give your children snacks, make sure they rinse after the snacks, or you brush their teeth. Guide them the way to brush their teeth, because they can't brush their teeth themselves. So you have to guide them when brushing their teeth and reduce the intake of sugary food you give to them. And also, one of the causes is also dry mouth.
Dry mouth?
Yes.
I heard about that, dry mouth.
Yeah.
They call this
xerostomia.
Yeah, xerostomia, thank you.
Yeah. When there is no flow of saliva in the mouth. And when you don't give your children a lot of water, when they are not hydrated, so you need to give them a lot of water, so they will, to prevent the dry mouth. So in adults, the causes of halitosis in adults is also poor, because some adults who don't brush their teeth, and they have to brush twice daily because the fluoride in toothpaste only works for 12 hours, and we have 24 hours in a day. So you have to brush in the morning and the night before you sleep. So in order for the fluoride to work well, so it's work on your teeth to strengthen your enamel. Wow,
thank you very much. Even though we are still coming back, I know that from your wealth of experience, you still have some other courses to talk about. But yes, let us still wait a while. Dear listeners, please, once again, please let us begin to drop our questions on the comment section so that our able guests in the studio will address them one after the other. You can reach us on 070-6756-5797. Once again, you can reach us on 070-6756-5797. 070-6756-5797. So, thank you again, once again, for joining us. So, what do you have in store for us today?
The psychological and social impact of halitosis.
Psychological impact and social. Hey, Jesus Christ, we see topic. Oh yeah, let's hear from you.
Halitosis, also known as bad breaks, can cause psychological and social impacts on people's daily life. Let me talk about the psychological challenges. We have low self-esteem. Individual will feel self-conscious about their bad breath, which can also lead to decrease of confidence and self-worth. We have obsessive behavior like overbrushing, excessive use of mint.
Like me now, I used to brush, I will go everywhere.
That's also called psychological.
That means I'm feeling like, oh, if I don't brush it like any of that, like my teeth will be smelling.
Yes,
So it's the wrong thing to do.
Yes, sir.
Okay.
And we have anxieties and stress. Individuals will be feeling judged, like they will be judged by others when they are feeling stressed. They will be feeling judged, that if they talk, people will judge them, they will cover their mouth. If our mouth is swelling. So we have depressed. Individuals will be depressed about their
depression.
Bad breath.
Wow.
Yes, and we have the social impact, like we have the social impact. They will feel introverted to feel with people. Like in strained relationship, their family and friends we avoid relationship with them. We have education and professional impact also. There will be restrained opportunities for them when they feel depressed also. There will be social isolation.
So that means in a gathering.
Yes.
Now in the gathering when all other people are talking, discussing, they will just want to segregate themselves to interact with people just because they are having that. Wow, Jesus Christ, this is really serious. So now, coming back to you, this halitosis of a thing, I understand that it is, a very significant factor, affecting people psychologically, as my second speaker, has highlighted. So in children, do you think children also feel the same way, like they don't want to talk or they feel introverted? Do you also support that ideology that children too, they sometimes seclude themselves just because the amount is smelling?
Children may not know that the amount is smelling because most of them don't think of such things because they are still small, and it is when people notice, they have guardian, and it is their guardian that know about it. So when any of them notice, they tell their guardian. Children doesn't really care about.
So they don't have this sensitive of smelling like elderly people.
They may not care about the stuff.
Okay, so what other factors do you think, could be the cause of this mouth odor in children and the elderly people?
For the elderly people, there are some systemic diseases that can cause halitosis.
Systemic diseases.
Like diabetes.
Diabetes.
So it causes halitosis to them. And in elderly people, so they do have dry mouths when they are not hydrated, when they don't take a lot of water. And in adults, smoking alcohol also causes halitosis. When there is much of alcohol and smoking, it causes halitosis as well in adults.
Okay, thank you very much. Let me turn to you again because I'm really getting a lot of experience here. Like, oh no, this is very serious. So, under the psychological effects, now, do you think that people who are affected with halitosis, the question is, why don't they seek for help? Why do they always feel like they always keep to themselves? Keeping to yourself when you are having such problem, it will not solve the problem. So what can they do?
And they can seek for professional help to help them provide treatment and underlying issues.
And underlying issues like okay, because the last speaker that discussed about halitosis said systemic diseases like diabetes and all other. So do you mean that diabetes and all other internal diseases, they also have a high chance of influencing bad breath?
Yes, sir.
Okay, so but those systemic diseases, that means they don't visit the dentist. They will have to visit maybe a normal medical hospital, right?
You have to visit the dentist too.
First, okay.
Yes.
Okay.
So underline the issues. We analyze the issues of the halitosis and treatment plan for them.
Okay. So that means that if I can get if I can deduce from your point, it means that once they visit the dentist, it is the dentist that will first, diagnose them, examine them, and see where exactly. That means we have multifactorial causes of halitosis. So the dentist will now start highlighting and observing each factor, so as to know what exact is the cause of the halitosis. Okay. So I also heard that dental caries, which is cavity, a hole in the mouth, also causes halitosis. Is it true?
Yes.
What about? I also had a tartar and what do you call it? Is it plaque or what do you call it? Plaque. Okay, also causes halitosis. So those are the first things the dentist will check, yes. Right? Okay. Okay. Thank you very much. And coming back to you, what exactly? How can the elderly manage, themselves or treat this, find solution to this oral halitosis?
First, they should seek medical help, and they should maintain good oral hygiene.
Good oral hygiene.
Yeah, they should maintain good oral hygiene and stay hydrated. Drink a lot of water, and they should clean their tongue very well. They should clean it very well, and visit dental clinic twice every year. That's once every 6 months.
Once every 6 months. So, what other advice would you, about the oral hygiene, would you?
They should make use of dental floss, as my first speaker has showed them. So, okay. This is the dental floss, and this is the they should make use of dental floss and make use of the tongue scraper as well, and make sure they use a medium toothbrush.
A medium toothbrush.
Yes.
So that means that this bristle, we have some of these bristles that are soft, some are medium, some are hard. Yes. So they should. But why should they use medium?
Because the medium is not too soft, it is not